Well, you know, there are a lot of things that we do that can make us look older, and that wattle, or turkey neck as it's sometimes called, is one of them. But there are many factors that can cause it and things we can do to fix it. Dr. Rebecca Kazin is here with us today to discuss some of those options other than surgery for making this area of the body look better once the sagging sets in. Good morning, doctor.
Thanks for having me.
You're very welcome. Thanks for coming in. I understand you joined us from Baltimore this morning.
Yes.
So
Go
driving
Ravens.
in. That stress is one of the things that can make you look older, isn't it?
It's true. You know, stress really wreaks havoc on your immune system, which can definitely show in your skin.
So today we want to talk about what we call turkey neck or wattle. What causes that?
Lots of things. Certainly genetics play a big role. There are a lot of patients that, regardless of exercise and diet, still cannot, reduce that area. Sun exposure does play a factor because sun exposure causes worsening of skin laxity, and then rapid, weight gain and weight loss. But what's amazing is there are so many non-surgical options we have now to address it.
And some people, that doesn't bother them. They don't mind the look of that. But if you do mind it, then there are things that you can do about it. Short of surgery, because surgery, it can be a serious thing.
Exactly. I mean, there are patients who want or need surgery, and we discuss those options. But what's amazing is for patients who don't need or want surgery, we now have great non-surgical options.
Well, skin is very elastic, but sometimes that elasticity goes away, especially as we get older.
Correct.
So what are some of the things that we can do to get rid of the wattle?
So it depends. If the wattle is more fat, and there's really no other way to say it besides more of a double chin, versus more skin laxity or looseness. The way that I can tell is if I pinch the area and I pinch and it's more like this, that's more fat. And if I pinch and really it's like this, that's just skin. And depending on what I find, that's how I advise the patient. If it's more fat, there are two great non-surgical options. One is the recently FDA-approved injection called Kybella. It's a series of injections to that area that literally destroys the fat over time, and it gets removed from your body just naturally as the fats that we eat. There's another treatment, I'm not sure if people have heard of the cool sculpting treatment where we freeze fat, typically in the midsection. Now we have an applicator where we can freeze fat here. So just two different options, depends on the patient, we tailor it to you, and that's to remove the fat. If we want to tighten the skin, there are lots of great options. One uses ultrasound, that's called Ulthera. Another one uses radio frequency called Thermage, and there's a new version of Thermage that works even better than the old one. And sometimes we combine them. Every patient is different.
What are some of the possible risks involved in these applications?
So fortunately, none of them are really harmful. Mainly it's some swelling. I tell patients usually about 2 days, so have it done on a Friday, go back to work Monday or Tuesday, sometimes some bruising. We do advise people to hold things like fish oil supplements, baby aspirin, and Advil type products a week before and a week after. Obviously, if you need them for a medical condition, you should stay on them. But those sorts of things. We give ice, we give really strict aftercare instructions, and make sure you can reach us if you need us. But generally, they are really well tolerated. I've actually done many of them to myself.
Well, you look fabulous.
Well, thank you.
What is the longevity of these processes? Do some last longer than others?
So what's amazing with these versus injectables like filler and neuromodulators like Botox is that what you get, you keep. The fat that is removed or destroyed is permanently gone. Now, if you gain or lose weight, the fat cells that remain grow or shrink, but that fat is gone, or that skin that we tighten is tight. So it sets the clock back, but the clock keeps ticking. So generally, patients come in for a maintenance treatment maybe once a year, every 2 years, something like that.
And of course, a lot of people want to know, how much is this going to cost me to look beautiful again?
Exactly. I mean, we really work with the patient. I'd say starts about $750. It really depends, but we work with everyone.
So it's options people have to look at and think about for themselves.
It's exactly.
Dr. Rebecca Kazin, thanks so much for joining us today.
Thank you.
You're very welcome. Some great things. I should have been taking notes. I'll watch the segment again online.